Hello, hello, all. Thank you so much for joining us. Welcome to another edition of Ask a Black Doctor. We know for many of you, this week marks the return to school. And for some of you, this week marks, the countdown to school beginning. For the past few weeks, we've seen pictures and videos of people discussing mask mandates, how to return to school safely. And so this evening, it's my honor and pleasure to fill in for our One Hood Media CEO and co-founder, Jasiri X, for Ask a Black Doctor, panel and programming that we're bringing to you courtesy of the Gateway Medical Society. Today, I'm joined by three amazing medical professionals to have a conversation about how do we safely return to school amidst this raging Delta COVID-19 variant. You can ask questions in the chat to our doctors directly, and we'll try to get to them throughout the program. To get started, please welcome our doctors who are going to take a moment to introduce themselves. And then when we're done, we're going to have some conversations, and we're very excited. And we'll go starting to my top. If you want to go ahead and introduce yourself.
So I'll start. I'm Dr. Rebekah Hughey. I am an integrative family medicine doctor and currently work as a medical director for Gateway Health Plan.
Good evening. My name is Dr. Robin Sims. I'm a board certified pediatrician. I am the medical director at Primary Care Health Services, located our main administrative offices in Homewood, Pennsylvania. I've been practicing pediatrics for the past 40 years. Thank you.
Hello, I am Dr. Shantal Villalobos, a fresh doctor, fresh out of residency. Very happy to be here, and I'm representing the Gateway Medical Society, of which is very honored as well to be in cahoots with One Hood Media to be putting on these shows for you. Gateway Medical Society's representation of minority physicians in Pittsburgh and other healthcare providers who are here out there trying to put information out to the community, make sure that we can be available, providing resources as well, and doing a lot of things. So we really hope that people can be in tune. We will have links and information about the Gateway Medical Society and other events and things that we are putting on, including this weekend with the symposium that we're going to be talking more about what we can do to prepare about getting into school. So I hope that everybody can tune in then as well.
Perfect. Thank you so much for that. And we'll be linking the Gateway Medical Society's information throughout the program so you can follow up with them directly. And it just, a lot of people have concerns about what's going on. Dr. Hughey, starting with you, can you just talk about how do schools open safely right now as this Delta variant is really just taking the nation and spreading rapidly?
So I just wanted to express there is concern amongst parents about how to send their kids back to school safely, how schools can open safely. I would say three main things. One is, of course, and we'll talk about this a little bit more, but if at all possible, anyone who can should get the COVID vaccine. That is the most important thing. That means staff, that means teachers, administrators, and then all the children who are eligible, which is right now ages 12 and over. Anyone who is eligible should get the COVID vaccine. Secondly, masking still works. It works to help prevent COVID. If someone is vaccinated, they can still carry virus. So getting to wearing a mask and then social distancing. So all of these three things, I would say, are the main components to keeping kids safe in school.
And thank you so much for that. Mm-hmm. And Dr. Sims, you said you've had over 40 years of experience. What is something that you believe that people are not understanding about this Delta variant?
I think they are not understanding the seriousness of this variant. And this may be one of many variants that we will possibly see in the future. I think a lot of our people are more worried about the vaccine and not worried about the disease. Sure, we can get side effects from the vaccine, but the risks versus the benefits of the vaccine far outweigh the seriousness of getting COVID disease. And I think we forget that. We have all these conversations, but COVID disease is serious. It's taking people's lives. And so we have to remind ourselves that we're not out of this pandemic. The way out of this pandemic is to get vaccinated, as Dr. Huey said. We have to encourage our friends, our families, our neighbors to get vaccinated. This is serious.
Thank you so much. And Dr. Villalobos, I hope I didn't mispronounce your name, but recently the CDC and the Biden administration talked about booster shots. What are booster shots? Why should people be taking them? And what are the eligibility requirements to get a booster?
So really good question. I know that people were very resistant to getting the vaccine in the first place. So the thought of having to get more, I know is overwhelming. I know many people are kind of over it and don't want to, but the way that vaccines work, we have known that some can give us kind of a life immunity. We get the one and done, and we know that others need boosters. People may be used to getting every 10 years, getting their tetanus booster shot, and that's something that is known, something that's going to recur, and that's the way our immunity works for those specific illnesses that we're protecting ourselves from. Well, COVID is new. COVID, as it's like unraveling and over the time that we've had to study with it and how people are responding with the vaccines, we've been able to know now if we were or not going to be needing boosters. And so one of the things that was kind of thought of ahead of time, we may be needing this, and now we are seeing that it is a recommendation to be getting a booster so that we can remain to have good immunity against COVID. And the biggest protection that we are getting with these vaccines is protection from death. That's the number one thing that we are trying to save our communities here. We have really great protection against death and severe illness. People can still get sick, and it's a difficult thing to conceptualize, but also to accept that you can still get sick when you have the vaccine. The odds go down, your risk is a lot less of getting sick with COVID, just a regular illness to a moderate illness, but you still can. The protection against death is very, very good. And that's what we are seeing, really good protection, but you still get sick. So we want to maintain that really good protection, and we're going to need to have people get boosters. At this moment, we have folks who are immunocompromised. If you have a specific illness that would categorize you under immunocompromised, you're right now qualified to be able to get the booster. But the Pfizer and Moderna companies have already come out saying most likely by next month, everyone will be able to be eligible for this and qualified. And it's within the time frame of 8 months. Many of us as healthcare providers are at that 8-month window. We started getting ours in December, January. And so we're pretty much at 8 months to where we could get a booster. So you may see it in waves as when people first got vaccinated or fully vaccinated, 8 months from then, they would qualify from being able to get another booster or getting a booster shot for Pfizer, Moderna. There's an information out for Johnson & Johnson, but it's very likely that you're going to need a booster having gotten Johnson & Johnson because Moderna and Pfizer needed them. So at this moment, it's known that immunocompromised folks should be receiving it. You're qualified, and we should start recommending that to folks if they are at the 8-month mark. And so we can kind of think ahead. Soon it's going to be open to everybody. And that's as soon as next month. And so we can start to think ahead and say, hey, let's continue to have this really good protection. And if you got the vaccine and you were fine, you did well, very likely because you had the vaccine. And so we want to continue that protection.
And so just because you mentioned Johnson & Johnson, can you just, a lot of people have been asking, why is there not a lot of information about the Johnson & Johnson vaccine? Can you just explain the process to going and researching the efficacy of the Johnson & Johnson and when and how they'll need a booster?
So every kind of company, if you think of it, Pfizer, Moderna, and Johnson & Johnson, we're at their disposal to be putting out the information, and the way that their research is being accumulated, they're each their own entities. And so we kind of can't say as a whole, this is how they are all working. What we do know is the way that vaccines can work and how research works. And so what we can say is once their information is out, then we can know for sure what's going on. But we can speculate at this moment, given the fact that the trends of the vaccines are working one way. I would actually recommend folks to keep an eye out for the same .gov, the same EDUs, the same information that you're getting from a trusted source where the information is coming out, like the CDC. that's one good source where they put out information about the 3 types of vaccines and the 3 companies, and you can kind of keep up to date, or you can actually look at like Johnson & Johnson directly. But it's really much at their disposal to start putting out the information. It just means probably that it's not out already yet to say. It's likely around the corner, and every day is ever changing. In a week's time, we may be saying things.
Thank you.
And to add on quickly to what Dr. Villalobos mentioned about immunocompromised, just to be clear. So in general, those people, let's say people who are actively being treated with cancer, or people whose immune systems are suppressed because they're on high doses of steroids, somebody who has HIV. If you've been told that you're immunocompromised or that your immune system does not work, it does not have a robust an immune response as someone else, then you may be immunocompromised. And if you're not sure if you fit into that category, then you can always ask your doctor, and they can let you know if you're in that category.
And I also wanted to add to information changes daily. And as Dr. Lobos said, you have to keep up. You have to keep up with the information. That's the wonderful thing about this platform, that we can educate our communities. And so the CDC just now recommended an additional dose for people who are immunocompromised. And so just to get the terminology clear, additional dose versus a booster. Right now, they're recommending an additional dose for immunocompromised people, which means that after 28 days of your second dose, they want you to get a third dose. Now, boosters are recommended coming for us 6-8 months after your second dose. So remember, you're not fully vaccinated until 2 weeks after your Pfizer or Moderna and 2 weeks after your 1-dose J&J. But right now, immunocompromised people, like Dr. Hughey just stated, even with children, sickle cell patients who are 12 and older, organ transplants, heart, kidney, you could be immunocompromised from diabetes, cancer treatment. You need that third dose, 28 days, an additional dose. It's not a booster, an additional dose, 28 days after your second dose or your first dose of J&J.
And thank you for that clarification, which is very important to try to distinguish, because those of us who've had it already would be looking at boosters.
Right.
Mm-hmm. And you're talking about second doses and boosters. A lot of people are asking, should my child get the vaccine? Is my child eligible for the vaccine? And coming to you, Dr. Sims, what are the requirements, the age requirements for vaccines? And what do parents do if one child can get the vaccine and another child cannot?
First of all, only one company, the Pfizer, is cleared to give to children 12 years and older. So if your child, your preteen is 12 years or older, they qualify for the Pfizer vaccine, and they still require 2 vaccines like adults. And so what if you're in a household where you have mixed, you have teens that are 12 and older, and then you have a little one in the home, like 5 years of age. So the most important thing is for the adults and the preteens and the teens to get vaccinated, because if you get vaccinated, you're going to likely protect your younger children from the disease. So you need to do that. But still, I would highly recommend that you teach your children to continue masking, as Dr. Huey said, to continue practicing physical distancing. School is starting. I mean, they're used to this. They're used to wearing masks. We can go and do our back to school shopping and get the nice masks that can match the different outfits, make it fun. But encourage your children to wear those masks during those school hours, to have hand sanitizers in their backpacks, to wash their hands frequently. And the teachers know, they have the classroom set up that the students are about 3 feet distance. So be careful. Don't be in the face of people, and remind your friends when you're in school. You got your mask on wrong. The mask worn correctly has to be above the nose, covering the mouth, and to keep the mask on. That's my strong recommendation.
Now, Dr. Hughey, there's been a lot of conversations about masks for students. For parents who are concerned about their child being able to breathe with the mask on, when we talked about, covering the nose and the mouth, are there different masks for different youth? Are people just wearing the mask wrong? We've seen pictures, of people saying, well, now my child wear a mask and now they have asthma. What's going on, and what is some of the misconceptions out there, and how can we correct, those wrong impressions?
So I hadn't heard that one. That's new to me. In general, there are a lot of different types of masks. There are a lot of different materials that people are using to make masks. And so I think that's part of the confusion. If somebody's making a homemade mask with a heavy material, they might not be able to breathe. But there are, one of the safest ways to, if this is possible for you to get, and they sell these in drugstores, sometimes you can get them free with certain programs, is a surgical mask. These masks can be worn all day comfortably. They're given out in Children's Hospital. You probably know what they look like. They sort of look kind of paperish. For kids, they'll have like little figures on them. People have been breathing comfortably in these masks all day for several days, for just decades. So I would say if you can get that type of mask, you should probably be able to breathe. Very few people might either feel claustrophobic or just a little bit anxious, and that might add to their sensation of not being able to breathe. But physically, most people can breathe with that mask. I can't speak to so many other different types of masks with materials that we just don't know about. And some just are safer than others, and some work better than others. So that would be my suggestion, is to have that type of mask. And then when you get a store-bought mask that's made out of cotton, like you said, the masks they sell that match people's outfits and things like that, those will probably be okay too. And if the kids are okay wearing those and they're comfortable and that makes them want to wear a mask, then I would definitely suggest those as well. So that will be my two recommendations.
And I would just add to that, if anybody, because you were asking about myths or dispelling things, is hearing about other types of masking, and you might hear from other states, there is some areas that are doing double masking. And that comes from the notion of being able to have enough layers. We're not going to get to the complexities of it, but a surgical mask we can trust because we know it has at least more than one layer. A lot of the cloth things that people are doing at home are one layer type of mask. And so you want to be able to have enough layers. And then you do hear from professional sources that they say at least 2 to 3 layers are what's going to be most protective. And so then that's where you have double masking occurring in certain areas to make sure that there is enough layers to the mask. And you should definitely make sure, if you see anybody with a mask with a filter in it, to know that that is not an appropriate mask to be wearing. Ask them kindly to change it and educate them a little and say, you're not actually protecting your community by wearing a filter, because you're just directly letting out what you are breathing out through that filter. So we do recommend highly against those filtered masks. They look like the little circular things on a mask.
Yeah, thank you for that. Because I know a lot of times there was a lot of conversations, because even you couldn't fly on planes with the filtered mask, and a lot of people didn't understand. They're like, a mask is not a mask. They all serve, different purposes depending on why they were created. And coming and talking, still staying with you. We saw today, UNC posted a video of everybody lining up at, the water fountain to celebrate, the first, day of school starting. We know that, a lot of schools have opened, and there has been a lot of cases. Some schools, have had to even shut down, have unfortunately even lost people's lives. What other numbers that we're looking at right now, and what are the numbers expected to be in the next 2 weeks when it comes to these COVID transmissions?
Well, unfortunately, I hate to report that the cases are still continuing to go up. The rates are ever increasing. We're still up like 90-something% comparatively from prior 2 weeks, if you're following certain data trends. And that is nationwide, but that is very clear and close to what's happening in Pittsburgh specifically. Our rates of infection that we're seeing are still continuing to go up. You have a majority of those cases being speculated to be Delta. And so the difficulty with that is it's much more of an infectious and contagious virus strain or variant, and thus we are more concerned. People with vaccines can still get sick, and let it be known, you could still get sick with the original COVID that we knew, the variant, and not just the Delta. But the Delta is so much more contagious and it's so much more rampant and it's spreading so quickly. We are concerned because even with vaccines, you're at a chance of getting sick. Now, if you're getting sick, you're likely going to be passing it on to folks. And you're around folks who are not vaccinated, and then we're really worried about those death rates and the death rates climbing up as well. So the rates of death are going up and the infection rates are going up. Vaccine rates are going up, but not as fast as we'd wish. So we want more people to get vaccinated to really get control of this. And what I speculate is that in the next 2 weeks, those rates are going to continue to go up. So we really want to aggressively really put things back on. We don't have the mask mandate back, but we really want to act as if it is. We want to take it upon ourselves to be good citizens and be responsible to protect our community members and say, you know what, this store says I don't have to wear a mask, but I will. I'm going to do this for the good of my community and for myself as well. And so then the mask mandate is something that we don't see yet, but I can also speculate will come back.
And I just wanted to mention too, it's back to school time too. So not only COVID, we have to remember about the other diseases like the flu virus is out here. One of my friends just recently thought he had COVID, but it ended up being the flu. So we've become comfortable. We were taking off our masks, we were socializing more, and now those diseases are coming back. Last year, we saw a decrease in flu disease. We saw a decrease in RSV, which is respiratory syncytial virus, a common virus that attacks mostly infants. But now there's a resurgence because we've become comfortable. Now it's time to remember to get our flu vaccines. Not only our COVID vaccines, but our flu vaccines also, because we have to be protected. And if you feel sick, you don't know whether you have COVID or the flu, go call your doctor, find out. They have rapid antigen tests that they could tell you within 15 to 20 minutes, whether it's COVID or the flu. And the flu is caused by a virus. And so if it's caught early, there are antiviral medicines that the doctor can give you. So remember, flu vaccine is important. COVID vaccine is important.
And
yes.
So, and you're talking about, people say they may have flu, may have allergies, I may have COVID. Can you walk through what are some of the symptoms that we need to be mindful of, and what are some of the key differences, even with the Delta variant, that we need to be paying attention to?
Dr. Hughey?
So this is a tough one because the three do share symptoms. So between the cold, the flu, and COVID. Between, what did you say? Between COVID, the flu, and allergies. Thank you. And this is close to my heart because I have allergies and I'm so paranoid over the last couple of years when I go out, like, let me take my allergy medicine. So I don't go and sneeze and everybody is a little scared of me. But I would say between COVID and the flu, you'll have, cold symptoms, runny nose, allergies to runny nose, sneezing. Allergies, I would say what distinguishes allergies often is itchy eyes and kind of the itchy eyes and kind of like a more of a feeling of swelling in the nasal passages, like an inflammation type feeling. And this is very general. What might distinguish COVID over those two is a very severe persistent cough. So a lot of people will report, coughing, not being able to stop coughing, and shortness of breath. So I would say if I were to distinguish COVID from the other two, it would be coughing and shortness of breath. If I were to distinguish allergy from the other two, it would be the itchy eyes and just like feeling like itchy and miserable in that sense. And then if I were to distinguish flu, I would say fever. Again, fever and COVID, flu and COVID can have fever, but the flus can have some high fever in absence of any other symptoms. So very generally, that would be my response. But like Dr. Sims said, if you are sick and you don't know why, go get tested.
And to add to Dr. Hughey's list, always keep in mind that there are other symptoms that you can look out for, like having what we call GI symptoms. So symptoms that have to do with your gut. And then you can think about the diarrhea. You can think about throwing up. Both can happen with COVID and the flu, but we are seeing that sometimes isolated. Early on, when we didn't know what really we were looking for with COVID. We kind of took each symptom isolated, and anyone walking in with diarrhea, we test them with COVID. And we found a lot that way, where that was the only symptom that they had. You don't normally see that with flu. You're going to have flu-like symptoms, and you're going to have at least somewhat of a runny nose, maybe a little bit of a cough, feeling like you're sick. You wouldn't have just diarrhea or just throwing up or just nausea or just a headache. You do see that with COVID, but any one of these symptoms kind of do overlap, and you can see them as like a combination, and with both flu and COVID.
And remember the loss of smell and the loss of taste to COVID.
Right.
These are COVID
Right.
symptoms, very distinguishing.
And you talked about testing. Can you, anyone can answer, what is the COVID-19 test currently look like? Remember at the very beginning of, this pandemic, everyone was kind of traumatized by seeing the videos. And now, the testing is a lot different. Can you talk about the different type of tests and what even the rapid antigen test is?
They basically still look the same. I think we just are not getting tested as we should. We should continue getting COVID testing, because that's how we're going to know how much COVID is in our communities. And so it's really that little swab with the, it could be dacron, looks like a cotton tip. Some people do the test orally, and it's now recommended to do the nasal swab. And so the gold standard, the more accurate tests are called the PCR tests. And those usually have to be sent out, and you get your results within 24 to 48 hours. The rapid antigen test that the doctors have in the office, that you can get an answer within 15 to 20 minutes. There are antigen tests, not as accurate as the PCR test that gets sent out, but good for the doctors kind of distinguish, is this the flu, is this COVID? And if it comes back negative, that fast test, that rapid test, they will send out that PCR test that comes back, and that's the gold standard. So basically the same. And what's new now, they have home COVID testing. So now you can get a home test that you can test yourself. It may be a good idea, like we had mentioned, if you have young kids in your home that can't be vaccinated, maybe once a week, maybe you should just test yourself with the home COVID test to make sure that no one in the family has COVID.
And coming to you, Dr. Hughey, when should people get tested? If I am hanging out on a Monday night, I have orientation, and all of a sudden I get an email saying there was somebody positive at orientation on Monday. Do I Tuesday go and get tested? Do I wait 3 days? When should I go and get tested? And in that time, should I be quarantining? Or if I don't have symptoms, is it okay to just go out and be out and about as long as I wear a mask?
Well, so to answer that last question, according to the CDC, if you had a known exposure and you're asymptomatic, you don't have to quarantine. So that's the answer to quarantining. As far as getting tested, so if you're asymptomatic, but you know that you've been exposed, because we know that if you're vaccinated and you can still carry virus. So if you've been exposed and you've been vaccinated, but you could still be carrying virus, for the good of the community, I would say it would be good to get tested just to see if you're positive, even though you're not sick. And that way you wouldn't have to quarantine, but you would stay away from people. You could, make sure you wear a mask and just take extra precautions. So, of course, again, if you have symptoms, definitely get tested and see if it's COVID, see if it's the flu, see if it's anything at all. But even in the absence of symptoms with a known exposure, I would recommend testing.
And I would agree with Dr. Hughey about if you have a exposure, still do your due diligence and go get tested and being careful. The harder part is the known. So if you got a phone call and said, hey, I just got tested and I'm positive, we were hanging out yesterday, that's a for sure exposure. Most of the time you don't know. Let's say you were hanging out, you went to a concert, you had a grand old time, you decided, I don't want to wear this mask, or you're doing something and you were there around yourself with the possibility of it, but you don't know. So the unknown exposure, but the possibility of it. So risk of exposure. So if you wanted to, I think the best thing is to, everywhere you go and what you do, to be wearing a mask after that, in case you are carrying. And that if you were to wait a day or two, I would say actually 2 to 3, for then testing, even if you're asymptomatic, because you won't be able to kind of mount enough of a response so that it could show if it's positive, but you'd want to wait a couple of days and then be tested and then see. Now, like Dr. Huey said, you don't have to be quarantined according to the CDC if you're vaccinated, but wear a mask everywhere you go, including the store, including it's not a mass group of people, including it's indoors. Be wearing a mask until you have that result to know for sure, because you probably should not be unmasked. Vaccinated or not, people should not be unmasked in major groups in areas that what we call, high risk for being able to get COVID and to spread COVID. And so those are the times that you really want to keep an eye out for. But if you're in an area where you're with other people who are vaccinated, you guys are spread apart, or people are in smaller groups, I think it's a little bit safer. But you still really want to be careful.
And what we touched upon really is the breakthrough COVID infections now. I mean, just because you're vaccinated, now we're saying that you can still get COVID. And that's one of the arguments that people say why they don't want to receive the vaccine. But still, we know now that if you're vaccinated, that you can still get COVID disease. But what the vaccine does is it really decreases your chances of having severe disease, hospitalization, and death. So it's still worth it. But you can be vaccinated, you can get COVID, you can carry COVID and be asymptomatic. You can carry COVID and have mild symptoms. You can get COVID and actually get sick and end up in the hospital. But again, weighing the risks and the benefits of getting the vaccine far outweigh the risks.
And just to comment on a couple of things, Dr. Villalobos mentioned one earlier, that we kind of knew there were going to be breakthrough infections with the vaccine. This is not new. This happens with any virus. It's not 100%. No vaccine is. And so even when this vaccine first rolled out, we knew that there were going to be breakthrough infections, and that we suspected that they would be able to carry viruses even when they were vaccinated. And so the point is that getting the vaccine, you may get the virus, you may be asymptomatic, you might get a severe or maybe moderate case of COVID, but the idea is that it prevents death and it prevents serious illness and hospitalization very, very close to, we'll say 98% of the time. So that's the first point. And then the second point that she also brought out is that, just be a good citizen. This is not just about mandatory masking or mandatory vaccines or mandatory anything. This is about us all swimming around together in the same air. So we're not really individuals in this case. We think we are, but everybody here who's breathing air is in this with everybody else. And so when you go somewhere and you wear a mask, you're saying, I'm choosing to protect not only myself, but other people around me. And it just is there's no way to be an individual in this circumstance or say, well, I'm going to do this even though everybody else is doing that. We're just all in the same boat. And I think the quicker we realize that, we need to look out for each other instead of just ourselves, which is hard in this culture. I think we'll be better off.
And just to follow up on that, there's been a lot of, misconceptions and misreporting. If I go to the doctor and I test positive for COVID-19, am I able and eligible to get the vaccine right then if I actively have a COVID infection, or do I have to wait? Because we're now seeing that some people, once they test positive, now they're like, wait a minute, I need to get the vaccine.
That's a really good question. I'll answer. So the medical answer, technically, you could, but the protocol that you should take, because you are infectious, is to wait. So you have COVID, you were tested positive, you should be home, waiting out quarantine, and you are now having to wait that full 10 days from when you had symptoms, or if you didn't have symptoms, but you just tested positive, 10 days from that day. And then you can get your vaccine. And the main thing is protection of others. There's still people who are giving you the vaccine. There's still people in the facility where you're going to get the vaccine. You're still going to and from somewhere. And so you're going outdoors. And so then that risk of exposure is not worth it. And we are not vaccinating people with the COVID. It's not because you're going to get sick. It's not like it's harmful to you. People who've had COVID recently can get the vaccine. It's not a negative effect to your body, but it is because you were currently positive and known to be, that we would not put anybody through an exposure, and you wouldn't be able to get the vaccine at whatever facility until you were out of your quarantine time.
And we know that COVID infection does give you an antibody response, which is somewhat protective, but getting that vaccine after having COVID increases your antibodies. So offers more protection, and studies have shown that too. A lot of people said, I had COVID, I don't need the vaccine, but you still should get the vaccine after your COVID infection.
And I went to you, Dr. Sims, because you had mentioned the flu vaccine earlier. Is it okay to get the flu vaccine, the COVID vaccine, all your other, vaccines for school all at the same time?
Yes, we follow the recommendations of the CDC and American Academy of Pediatrics. And yes, you can get those vaccines at the same time. But just a caveat, the flu vaccine, there is a live flu vaccine that is an intranasal spray, and a lot of kids prefer that. So not with that, but all your DTaP, your meningitis, your flu, your COVID, you can get them all in the same day. No contraindications.
No shots.
At this point,
You
though,
just brought
kids,
flashbacks.
right? The kids who can get the intranasal can't get COVID because they're not technically of age yet. So you don't have to even worry about that. And if I may add, pregnancy. So now we can say comfortably that if you are pregnant, yes, we are recommending that you get the COVID vaccine. And so it's important that all women get their COVID vaccine and right away when you know you're pregnant.
And also, I'm sorry, I just wanted to make sure it was clear about the flu vaccine. You can get the flu vaccine 6 months of age and older, not newborns, not young infants, but 6 months and older, you can get your flu vaccine.
That's very important. And one of the things people talk about, sickness and death with the COVID vaccine. This past weekend, I had conversations with 3 long haulers, as they call, and they have talking about, it feels like I feel like I still have COVID-19 even now. And so a lot of times people are saying, well, I don't want to get the vaccine because, COVID is not that big of a deal. It's like I have the flu for 2 weeks and I can just go ahead and go about my life. What are some of the long-term effects that you're seeing for people, after they've had those positive COVID-19 tests? Coming to you, Dr. Villalobos, and then you, Dr. Hughey.
Well, couple of different things that we're seeing. So you have the long hauler effect that you're talking about, people who had COVID. It may have been mild and it may have been severe because people can have an extended period of time where they're having symptoms and not feeling like their normal selves or completely back to 100%, as you would say. And so then it could have happened at a mild case or the severe case. And so that's important to know because even if it was mild, it's like, why do I still feel crummy? You could have been so bad and felt so sick, but didn't have to go to the hospital because you didn't need oxygen support and you didn't need something that was at the hospital that wasn't at home, which was just rest. But you could have been extremely fatigued, so fatigued that going to the bathroom and back was all you could do for the day. And that's something pretty extreme. And so if that was your case, but you weren't hospitalized, you may see that you're going to be lingering around for a while some people have months of fatigue. Some people have months of not feeling back to their complete selves. Some people have had like lung problems. And so you have people get emphysema, you have people get bronchitis, you have people get different pulmonary conditions from any illness. When people have repeat illnesses, that tends to happen more. And so if you have something that was so new or so intense to your body system and it affected your lungs, you could be having maybe more asthma attacks. You could just be more prone to it. You could be more weak to it. Maybe you're not feeling like your lungs are back to their tip-top shape. And so then that's something that you're going to see for a prolonged period of time. But then there's also things that can happen as a sequela, we would say, of COVID. So you had COVID, whether or not it was mild or severe, and then weeks later, you could have this inflammatory response. We've been seeing this a lot in kids, and this is why we're very concerned and want everybody to have their vaccines, where it's actually kind of, it is deadly. It's a risk of death with having Miss C or Miss A. It's a multi-inflammatory system response that you're having in the body, having this inflammation, and we're trying to understand it more, but it tends to attack several organ systems. And so you could have been mildly sick, and you say, hey, what happened? What's going on? A month ago, actually, I had COVID. Like, let's test you. And you see a lot of markers. We do a lot of blood tests. We have you in the hospital usually at this point because you don't know what's going on. You feel really sick and you're like, I don't know if I have COVID again. You're like, this may be actually Miss C or Miss A. Miss A for adults and C for children. And so we see these extra situations occurring when somebody had COVID. And then those actually could be a lot worse for someone, have them be hospitalized or have prolonged term effects or having them be slow to respond or going back to their normal base. So you actually have kind of multiple things where it felt like the first original illness never went away or you never got back to your 100%. Some people may never. Some situations are the case that we know in medicine. An illness could put you out and you will never be back to your normal self. When we tell people with strokes, you say, let's see how much you can get back your physicality, because you may never go back to your baseline, what we call. And so that's what you can be seeing. Or you can see you were back, you were same, but this extra inflammatory situation happened after the fact. And it's usually 6 weeks after.
Yeah, and so just to emphasize that those long haul symptoms do exist, and they're very real, and they are, a risk of being unvaccinated and of getting the COVID, the virus. Now, just to add on to some of the symptoms, people will say that like a brain fog, in addition to the general fatigue, like a brain fog, trouble with memory, trouble with concentration. So those are some things. And then again, just the shortness of breath, decreased exercise tolerance, where the things you used to be able to do, you can't do anymore. You can't figure out why. And those are all things that can last several months. And so when people talk, and so this is why I love this question, when people talk about, we don't know the long-term side effects of the vaccine. I don't know if it's safe. I don't know if I should get it. And like Dr. Sim said, we're less concerned about the disease than we should be, because we know for sure that there are long-term effects of COVID infection. We know those for sure, and we know that they're not good. And so, again, a chance to advocate for getting vaccinated, because we know that there are long-term consequences to getting COVID, not for everybody, but for enough people that it's concerning, and it's something that you don't want to find out afterwards.
And if I may add, the other one would be the fact that it's a hypercoagulable state, which means that you're more prone to making blood clots. And that's a very scary thing, because any blood clot can be very, very dangerous, including to lead to a stroke, a clot in your lungs, clot in your body, in your legs. And so then those are very concerning. If I may share, my mom, I think, had COVID, and about a month afterwards, she had what we call a mini stroke, a TIA, where the clot will go to the brain, but it ends up moving out of the way so it doesn't stay and cause permanent damage. And that was very, very scary, because you're like, you had a mild case. It's pretty bad. Long time she was sick, but didn't have to go to the hospital. And yet you still have these like risky things occur down the line, where she could have had a stroke and some scarier things happen. And so there's definitely not anything benign to COVID. And the risk of spreading it around when you're asymptomatic and having someone else pass away, God forbid, it's just never worth the risk of that versus getting a vaccine.
And there's a much higher chance of being hypercoagulable and getting a blood clot with COVID than there is with the vaccine, because there was this big deal about clots with the vaccine. And it was very, very, very rare, but it was amplified in the media. There's a much, much higher chance of getting a clot, having a stroke, having a heart attack, having a clot in your leg with getting COVID than there is with getting, just very, very, very high, much higher with getting COVID than getting the vaccine.
And I just want to add too, as far as the long haulers, the people who have these symptoms, I would still recommend that you see your PCP doctor, because although there is not a specific treatment, but there are rehabilitative services that they could send you to. They could work on your pulmonary function. They could work on PT. They could send you to neurological rehab services. So just don't sit home. I had COVID, I have these symptoms, but actually see your doctor, and they can refer you, because there is help.
Yeah. And coming back to you, Dr. Villalobos, you said that, your mom didn't go to the hospital. For people, who have COVID-19 or suspect they have COVID-19, at what point should they go to the hospital? At what point should they request, a medical professional's intervention? So there's mild cases and there's severe cases. And we know a lot of hospitals are now at capacity in some places for ICU beds, and people don't know who they're supposed to call. Can you walk us through some of those processes and questions to ask ourselves before we go to either ER or urgent care or another medical facility?
Yes, really, really good question. And I hope everybody is kind of asking themselves this question: what would they do in the scenario of? I'm not going to get on a soapbox, but I would say I wish this country was a little bit different in who can access medical care. I believe it's a human right. And so I wish I could say everyone always has a doctor call. Not the case, and not true. That's why we even exist right now in this forum, as a Gateway Medical Society, because if any of you watching this have any questions or anyone you know, please, please, please don't feel bad at all or hesitate to reach out to the Gateway Medical Society with questions. To say that everyone should reach out to their doctor or a doctor. No doctor, we're all three primary care doctors here, and we would be very, very glad to receive any message or phone call from our patients and say, hey, you know what, I'm not feeling well, I'm having the symptoms, or I think I have COVID. Talk me through it. Perfect. Let's talk about it, because it could say, look out for these symptoms specifically. Let me know how you're doing. As soon as you're having this, you need to come through, or this is going to be the XYZ plan. So even in the mildest form, have somebody you can call up. Don't feel bad. Always be ready to call and ask. But on your own, and if you're at home, the biggest thing is that's going to be determining if you need to be in the hospital or not, is if it's something at the hospital that you can't have at home. And so shortness of breath, not being able to breathe, that's number one thing that you really need to be looking out for, because you may feel like, oh, I'm just a little tired. It took a little bit for me to walk to the bathroom and back, but that's shortness of breath. And so you may be actually too low on oxygen, and you need to actually get oxygenation. So you should definitely be seeking care, or at least calling about it to someone. If you're having chest pain, that's not an okay thing. It may be in the end something like you're having bad acid reflux because of your COVID, but still is important to be on the phone, if not immediately calling 911 for these type of symptoms. I think it's always really good to be able to be comfortable to reach out and say, hey, I think this is either I'm exaggerating or not, and they can say, hey, definitely go immediately. So it's really important that you feel comfortable to ask at any point. So I want people to think first thing at hand, call my doc, ask a doctor, ask a medical professional to get their opinion as to I go to the emergency room now or wait it out at home. They can send me medications. The other thing is that if you're having symptoms and you're doing your due diligence by staying home, but you're not sure this was COVID, there's drive-through testing. And so then they can recommend to you, yeah, you know what, go through this local drive-through testing area, or I can write you a prescription to go get the testing nearby. And so then those are different things that we can do for you. But we want people to kind of think about their symptoms and then be able to reach out with any of the questions, or even just the fact that you're at home and you're throwing up a lot. You may be like low on fluids and you might get really dehydrated, or depending on the age, it could be very dangerous for a child or an elderly person to throw up too much. And so then you need electrolytes and you might need an IV. So you might actually need to be in the hospital for that. And so then never hesitate to reach out, and always feel like you can have somebody to call. If you're uninsured or underinsured, then you want to know about some resources that we can plug you in with. And I think we put the link on our website there, so that you can always ask, like, where do I go? So I can have a plan if something were to happen to me or a family member.
Better safe than sorry.
And I know it's different, but for a lot of places, at least here locally, the testing for COVID-19 through your medical providers are free, and with some of the local and hospitals, the treatment for COVID-19 is being forgiven. Is that still correct?
I can just answer to the testing. Definitely, COVID testing is free.
Okay.
They don't charge your insurance. As far as the treatment there is, and the adult doctors can speak to this. The antibody treatments. I don't think that those are free.
I don't think so either. If there's a special program, I'm not aware of it. There might be.
Okay.
But for the most part, I'm not aware that these treatments are free or forgiven.
Yeah, I think the hospital by hospital are kind of working to say, this person did have an insurance and they received the treatment, let's work with them. Because otherwise it's going to be based off on your insurance. So if you have insurance, it's going to be built to that, to where you won't have a big old copay. Hopefully not too bad, but it's going to be just like any other medication you may receive in the hospital. Testing, all of it is free, whether you have insurance or not. If you have insurance, it gets billed to your insurer and it's free. And if you don't have insurance, it gets billed to the state and the health department locally. And so that's Dr. Bogan who's signing off on all of those scripts, but it's still free for everyone.
Okay. And can you talk a little bit about what the treatment is? You know, we saw recently the governor of Texas got, COVID-19 and is receiving, I believe, this antibody treatment. Can you just talk a little bit about the treatments? And I know it's different for different, based on the, availability of the medication. What should somebody expect if they're positive and they go to the hospital? Whoever is treating, COVID-19 patients can answer.
So off the top of my head, I can think of two major things that we were giving in the hospital. One is convalescent plasma, and This is plasma that, from someone basically who's been exposed to COVID, and it has antibodies in it. And so that's been given to severely ill patients as a way to boost their immune response and help them to get better and help them to fight the infection better. Again, this is not a standard treatment. This is something for people who are severely ill. And so there's a list of qualifications that hospitals will have for patients to qualify for convalescent plasma. And then there are medications like the one that we hear the most about, I guess, is remdesivir. Yeah. And that's also geared to help the body's immune response toward COVID. Again, for severely ill patients. So those are specifically COVID targeted treatments. For someone who has COVID who's not severely ill, they can probably expect to at least get oxygen and IV fluids and supportive treatment. And so more than likely, again, if there's no severe illness, this is the most common way that people are being treated with COVID, is with what we call supportive treatment.
We do also have when people who have mild cases, so people who were like, we happen to catch, but they can go home, monoclonal antibodies. And so then we do have like a treatment for folks to say, hey, this is in the early stages and this is a non-severe situation. So it actually can help people right through. So we have medicines, and that's what we want to get people like early on. Or if we're in the outpatient setting too, then we can refer people. And here in McKeesport, we have some programs set up so that we can say, hey, we have the script, we just ask a couple questions and we make that happen. And when you have more of a severe case, or if you're in the hospital, then we do have certain different antiviral medicines, remdesivir being one of them, and some other medicines that are in line that we can give folks. And then when you have extremely severe in those cases, then you start to get into having steroids and having some of those other immunosuppressive medicines. So there is actually, for the different various types of COVID that you may have, some help that you can have. Supportive being the best, and just helping your own body and immune system fight it.
So we're, as this hour is like winding down, a lot of people, still have, vaccine hesitancy, resistance. Some people legitimately are afraid of the vaccine, and some people, for whatever reason, feel, very strongly politically and religiously about vaccines. If each of you could just talk, what would your message be to people, who are scared or haven't gotten the vaccine? Starting with you, Dr. Hughey, then you, Dr. Sims, and then you, Dr. Villalobos. What would your message be to people?
My message would be, again, you're taking a much bigger risk in not getting the vaccine than in getting the vaccine. You're taking a much bigger risk if you're not getting the vaccine. So if the fear is the vaccine itself, again, there are very few and very rare side effects that we've seen from the vaccine. There are very real and concrete risks of getting COVID. So if it's a risk-benefit question, if you're just being logical about it, which one am I safer with? We already know that getting the vaccine is much safer than getting COVID. So that would be my message.
My message is ask your questions. We're here to listen. We're here to answer. People say this vaccine was made too quick. Yes, this was a quick vaccine. It was made in a year, but a lot of smart people and a lot of money went into developing this vaccine. And we know that this vaccine is safe and this vaccine is effective. It saved millions of lives. So I will encourage you, ask your questions. You should have concerns, but we're here to answer them. And we encourage everyone to get the COVID vaccine. We can climb out of this pandemic, but we need the help of everyone. Thank you.
To add to Dr. Sims, though, the vaccines technology has been worked on for several years, and they've been working on perfecting that technology. So that's not new. Just COVID is new, and they were able to apply the very last step when it takes to creating a vaccine. But my message would be, what's difficult is to have one overarching thing that we can kind of say to the community that we all are in agreement with, because it's not faith, it's not a religion, it's not, for the community, it's not individualism, it's not some one thing. So it's hard. But I would say whatever that is that you believe in or not, this virus believes in you. And this virus does not discriminate. It will come for you and for everyone you know. And unfortunately is attacking the Black and brown communities at a much more aggressive way than we're seeing the other counterparts. So if you have folks you believe in or trusted people in the healthcare community, reach out to them. We hope that we may be some of those folks, but just trust us and say, we love you, we care about you and your family to continue and to thrive and be the beautiful selves that makes this country what it is. And so we are all here to protect each other. And so we want you to kind of reach out and say, what is it that I believe in? And say, who do I trust in that? If it's your faith-based folks and you reach out to the same, pray on it, then that may be something you can turn to, but say, you know, what in the end is going to be my harm by getting this? Because ultimately, you can't not do something. By not taking the vaccine, you're actively being in a community where there is a virus. The virus does exist. And so you have to take a choice. Do I not do the vaccine or do the vaccine? But you're not just not doing anything. You have to accept that you are actively choosing to put yourself at harm and your family members. And so then look to folks you trust. We hope that you get the vaccine, and we're always here to answer your questions.
And then speaking of looking to folks you trust, I believe at the top of the hour, you had mentioned that you have an event coming up at Gateway Medical Society. Can you talk a little bit about that?
Yes, this Saturday, and I'm so awful, I have it on my calendar. I believe it's at 11. We have a symposium. It's going to be virtual, and we can find the link and we can find information on our website at the Gateway Medical Society. I'm pulling it up right now because we would love for anybody to tune in. You can have more access to us and ask questions and be able to be available for, it's at 11 this Saturday. It's the Gateway Medical Society. We have a symposium where people can learn more information about going back to school and having more doctors in a panel like setting like this. And we can have those flyers and information to the website if you link them there.
Perfect. Thank you so much. And again, you know, like I said, a lot of parents, you know, are wondering what should they do because school's opening back up. We've seen some professors and teachers actually resign. You know, today, you know, some Spelman professors actually said that, you know, they're going on strike because there's not enough precautions to protect them from getting COVID-19. So as we wrap up, what are some questions that parents should ask their school districts? You know, PPS, I believe, is starting September 3rd. What questions should parents be asking about, whether it's the ventilation systems or the extra mask, you know, to make sure that they have all the information, you know, to send their kids? And we'll start, you know, Dr. Hughey, Dr. Sims, and Dr. Villalobos.
Well, my daughter's at Spelman, so I just found that out today. That was touched it, yeah. And so that goes into what my answer is, which is, what is your plan to protect our children? What steps are in place to keep the children safe, to keep them from, you know, contracting COVID? And also, if parents have kids going back to college, what is the quarantine plan? If kids are going to be on campus and, you know, somebody does get COVID, do you have a space for people to get better or to be separate from the rest of the students? Is this plan known amongst the faculty and staff? Is everybody on the same page, and is everybody on board with the plan? So those would be my questions for the school.
My question would be, ask your school district, what kind of mask policies do they have? You know, what are the classroom policies? Are they going to space the students out? Are the students required to wear the mask all the time? Are there times when they can take breaks? Also, I would ask them, do I have a choice? Can my child do virtual learning if I'm not comfortable with sending my child to school? Because that's an option for a lot of schools, and some parents are not comfortable sending their children to school. And I would also ask, are your teachers vaccinated with the COVID? And if you do intermittent COVID testing of the teachers and the students?
Those are really good questions. I would also add to find out what the spacing policy is in the classrooms. And as weird as it sounds, I would ask about, you know, the consequences of not wearing a mask for the students. And so what are they doing if a student was found to not have a mask? Do they tell the family members? Do they tell the students? Does the student have any repercussions? At the same time, what if somebody were to get sick? So can a student miss school and being a good citizen by staying home? Are they going to get in trouble or be penalized for having missed classes? So you want to make sure to ask, is it going to be okay when I choose to have my child at home more days than usual because I want them when they're sick with anything to be home? And you want to know what those policies are, or the virtual options if you wanted to opt out. And if they're being tested, that's actually really good to know, so you can keep an eye on the outbreaks, because you have young kids who are going to not be wearing their mask. And so you want to kind of know their amount of exposure.
And a lot of children who can't get vaccinated because they're less than 12.
Exactly.
All right. Well, that concludes our hour of, Ask a Black Doctor. I do want to thank Gateway Medical Society for partnering with One Hood Media, and I want to thank all of our doctors for showing grace with me. I know I am not just Siri, and so I really appreciate you taking the time to have this
Good job.
conversation. I appreciate
Thank you,
all.
Miracle.
And again, thank you all for working a full day and then hopping on, here virtually after being patient. So thank you. And with that, we will see you all next time. Have a good night.
Good night.
Thank you. Good night, everybody.